just making sure they understand the current scenario. Can you think of any recent phone calls you've gotten that apply to that?
Sure. So, one of the recent phone calls that I got started, I should say, the very way that you just described, with, hey, so I wanted to call you about this patient who, the initial call was for XYZ. I'll get into the sort of specifics in just a moment. But after they told me a brief intro to the situation, and the patient's alert-oriented times 4 GCS 15 common cooperative. And then it stopped there. And in my head, I'm going, and like, what have they told you about what's going on? What have they told you? It's just exactly as you said, John. Do they understand the risks, the ramifications? Do they understand what's actually going on around them? And so this particular patient was even on the more dicey side of the spectrum of capacity, because there was a potential mental health component to it. They hadn't contacted EMS. They were in contact with their therapist, and there was something was communicated to that therapist, who became concerned, reached out to local EMS, who then presented to the scene. And the patient never wanted to go to the hospital. They were looking for additional resources. What can I do about my current mental health? And was very clear, like, I'm not going to the hospital. Okay, why aren't you going? And when I delved into it a little bit, okay, why aren't you going to the hospital? I don't have that kind of money. That's a rational thought there, right? Mm-hmm. Which leads me into some of the specific components of capacity.